I'm Sarah Walker. I'm a researcher at the University of Oxford, and I run the Infections in Oxfordshire Research Database, or what we commonly call IORD. So what is IORD? Well, when people come to hospital or have blood tests taken at their GP, and those samples are then tested, that information is stored in large NHS databases. And we call this information electronic health records. So the Infections in Oxfordshire Research Database, or IORD, contains some of this information. But IORD is different from the NHS databases because it doesn't have any personal information like patient names or addresses or birth dates that could directly identify someone. Instead, it's the NHS that combines people's records and then gives each person a random number before sending their information into the IORD database. That way, we can tell which records belong to different people, but we don't know who those people are. So it's a way to have a secret code to keep things private. Since 2009, IORD's been working hard to help our healthcare system become better at dealing with infections. So we try to use IORD data to learn more about infections and work out how we can treat and manage them better in the future. So if you've come to the Oxford University Hospital's NHS Foundation Trust for an appointment, for a scan or a blood test, or you've been in hospital here, or you've had blood taken at your GP surgery and tested at the hospital, then IORD includes some of your health data, but it doesn't include your name, your address, your date of birth, or NHS or hospital number. You can find out much more about IORD on the rest of this website. But the most important thing is that IORD uses information that patients shared with the NHS when they were getting medical care. What we're trying to do is to conduct research on that data to make healthcare better for everyone in future. So we're trying to work out how to keep people healthy, how to get better treatments for infections. And we also use the data to find out how what we're doing now to treat infections is working and help the NHS plan how to take care of people in future. We spend a lot of time thinking and working to make people's data safe and protected. We have rules in place to make sure that how we use the information is the right way, and we want people to understand how we're using their patient data. Information about you doesn't have to be in the IORD database if you don't want this. And if you've got any questions or concerns, please use the email or the phone number on the web page and get in contact with us. Thank you.